Thank you all for coming. This will be a quick talk. I'm just going to talk about how to make children stop getting worse and worse and worse with their glasses. So we call that C.A.N.D.Y, Control of Astigmatism and Nearsightedness in Developing Youth. A lot of people always ask me when their child needs glasses for the first time, is there anything we can do to prevent it getting worse and needing glasses more and more often? And I've always confidently said, no, there's nothing we can do for you, and that's pretty much all there is. And since I graduated 15 years ago, there's been new science and new ways to actually stop kids from getting worse. So the first thing to understand is that myopia ain't getting no better. There are more and more kids getting more and more nearsighted, and they're ending up a lot more nearsighted than they ever were before. So we're having more and more severely nearsighted children. So one telling statistic is that in 1971, 25% of American adults were nearsighted, but in 1999, 41% of American adults are nearsighted. So what that shows is that it's not all just genetics, okay? If it's getting worse, we didn't all just have genetic mutations in the last 28 years. Something's changed. There's a nurture aspect to it, is what that shows. So a lot of people will say, who cares? Nearsightedness, people get glasses, and they can still see with their glasses on, so why does it matter? Why is it that big a deal? And the big thing to understand is when a child gets more and more nearsighted, the eye actually gets longer. It stretches from front to back. And that has associated disease with it. Actually, the more stretched the eye gets, the more the inside of the eye, the retina gets stretched, and that would be make the eye more prone to a retinal detachment, the retina actually tearing. And that's not what you want. Also, it's associated with higher and higher risk of glaucoma as the eye gets longer and longer, early cataracts, things that are bad. Furthermore, you just don't like seeing your kid getting worse and worse and worse and needing stronger and stronger, thicker and thicker glasses and being more dependent on them. At first, your kid can walk around, they'll be okay, and then if it continues to progress, they need it for everything. They have to have it all the time, even for reading eventually. And the other thing would be, as they get worse and worse, they're more and more likely to seek out LASIK or other surgical procedures. And the more myopic you are, the more those procedures are risky. So what can we do about it? What my profession has been saying for decades is what we call visual hygiene. The first thing would be to obey the 20-20-20 rule, which would be every 20 minutes while you're performing some sort of near task, take a break every 20 minutes for 20 seconds and look at something 20 feet away. Going outside has actually been shown to prevent myopia from occurring in the first place. Studies show that if a kid is outside, for every hour per week a child spends outside, they are 2% less likely to become nearsighted. Just at all become nearsighted. So, so two kids that actually read for hours and hours a day, but child A goes outside more than child B, child A is less likely to become nearsighted in the first place. The other thing to just consider is that more and more with adults, they have more of what would be a more friendly working distance. Generally, adults or people who work have, they're farther out, whereas kids will often spend a lot of time working, especially with phones now, about 10 inches away from their eyes, which is in and of itself stressful and can likely cause nearsightedness to progress. And this just shows the best posture for a child. You see the kid has the feet pretty much flat on the floor, thighs are parallel with the ground, back is straight, and the slant to the actual surface that they're looking at. That would be the optimal position right there. Good equal lighting is likely quite important. You want lighting that is equal on both sides, otherwise that can have cause problems with tracking, make it more stressful. And fluorescent lighting is definitely not as good as incandescent lighting. Incandescent is much more like the sun. Fluorescent lighting, not so much. So finally, we're to what we can actually do to prevent progression with children. If your child actually becomes nearsighted, what can we do about it? There's a lot of studies that show that actually giving a child soft bifocal or multifocal type contact lenses will slow the progression about 40%. So you could give a child standard distance glasses or distance contact lenses, but if you give the child multifocal contact lenses, just standard soft multifocal contacts, generally it's about a 40% reduction in their progression over the years. What's been known for about 90 years is that we could prescribe 1% atropine eye drops to a child. So you give the child just one drop a day of 1% atropine, and their progression will slow down 90% or 80%. It'll be a very high slowdown. So it's a fantastic way of slowing down, or I should say it's an effective way. One drop of 1% atropine will actually dilate the child for about 2 weeks. So that means blown gigantic pupils for 2 weeks, and we're saying this therapy would be every day. So that would mean horribly sensitive to light and can't read at all. So children who do that need glasses that have full-on, very strong bifocals that turn dark when they go outside. And most people are just not going to be real excited about that treatment modality. However, what's newly figured out is that instead of 1% atropine, 0.01% atropine can be prescribed. And that will slow progression down 55% with way less side effects. So that would be a much more tenable solution. Now, the actual effects of reading haven't been fully research to my satisfaction, so if I do prescribe that to a child, I would want to see them for very thorough examinations of their focusing ability before they're actually on the drop, and then 2 weeks after, 6 months after, and then watch them about every 6 months. But this is a way to strongly reduce the side effects, and you still retain 55% reduction. And finally, there's gentle vision shaping. This would be a completely different way of compensating a child who cannot see far away. Instead of giving the child glasses or contact lenses, what can be done is you can actually design a retainer. So this would look like a small little plastic contact lens that the child would wear only while sleeping. So it would just cause a temporary change to the cornea. It would only last the day. It's completely temporary. This is not surgery. So the child would sleep in it every night, but then run around all day with no help at all. This is showing light going into an eye, and it gets focused too quickly. So that's one definition of nearsightedness. You put an eyeglass in front of the eye, it focuses onto the retina. That would produce a clear image. Another way to do that would be to do LASIK, or laser surgery, which you can't do it with a child, but that's another way of treating nearsightedness, and this would be the last way. You actually put a retainer on the cornea, the child goes to sleep. We're talking changes in terms of microns here on the cornea. So while the child sleeps, it just slightly changes the cornea. They wake up, and they can see well for the day. Children who correct their vision in that way, many studies will show, for the last couple of decades have shown about a 50% reduction in progression when doing it that way. But there's been new studies that show if you actually manipulate some of the parameters of the retainer, you can get an 80% reduction in progression.